Hey everyone, thank you for coming to our presentation. I'm Shania.
I'm India.
All right, so today's presentation is about promoting aphasics communicative effectiveness PACE.
So this is the overview of the topics. We have first the background and history of the therapy. Second is the rationale or the theoretical reasoning. We have the treatment process. Then after that, we'll have a performance of the treatment by us, the presenters. Then we'll have the long and short-term goals. Then we'll have the apps to support treatment. Number 7 is the patient caregiver information and also the education part. Then we have the cultural considerations. Next, we have the outcomes of treatment, and then we'll have the limitation of treatment. Okay.
Okay, so let's get in the background history of the therapy. So PACE therapy is an acronym for promoting aphasics communicative effectiveness. It was established in the mid 1970s by Abilene Davis and Jean Wilcox. The treatment was developed at the University of Memphis, particularly during a period when the approach of aphasia in the United States was predominantly emphasized the restoration of language capabilities by conventional techniques. The creation of PACE was shaped by the notion that individuals with aphasia will communicate more effectively than verbalize, resulting in more involved and natural therapeutic approaches.
Mm-hmm. Now we have the rationale or the theoretical reasoning. So the theoretical foundation of PACE therapy is based on the belief that effective communication is not solely dependent on the correct usage of language. It underscores the significance of natural conversational interactions. The therapy is intended to enhance communication efficacy rather than solely emphasizing language repair. The objective of this method is to observe natural communication that individuals engage in natural settings, which implies that therapy should replicate these genuine interactions. So that's all to say that the goal of this is really to get that natural communication going on with the clinician, the client, and outside of the clinical setting. So when they go interact with their family, their friends, strangers on the street, if they might see anybody, this is just so they had that back and forth, like, turn taking type of communication instead of looking at a sheet of paper going, how was your day? Okay, my day was fine. How about you? Like, not so robotic, more, free flowing, natural with it. Nice and genuine. All right, we'll continue.
All right. So moving forward, speaking on genuine conversation, we're getting into our natural communication topic. PACE therapy posits that individuals with aphasia frequently communicate effectively when they articulate words. The therapy seeks to establish conditions that encourage natural communication as compared to relying primarily on structured language tasks. Our next topic is observation progress. The therapy is relying on real life conversational interactions instead and is driven by observation. This facilitates adaptability in the application and urges the clinicians to customize the treatment to meet the unique requirements of each patient.
All right, we'll continue. Okay, so for the population, PACE therapy is primarily intended for individuals with aphasia, a condition that impairs communication abilities as a result of brain injury or neurological conditions. The treatment is appropriate for a broad spectrum of patients as it is effective for varying degrees and types of aphasia. The rationale for focusing on the demographic is the recognition that the quality of life for individuals with aphasia can be improved by enhancing their communication effectiveness, allowing them to participate more actively in daily activities and social interactions. So, as we already said, individuals with aphasia, they are the main or target population for this type of therapy because what we're really trying to do is get them on the level of not what is it, saying like the language correctly. We're trying to get that language to be more, what is it, have more meaning and depth to it.
Semantics.
So yeah, we're just trying to get that back and forth going. Like, what are you interested? Okay, let's talk more about it. So that's what we're trying to do here. All right, we'll continue.
Okay. So now we're going to get into the process and the steps. So setting up the activity, the clinician prepares a set of materials, typically using pictures or objects that can stimulate conversation. Those are like the visual cues. The goal is to create a context that encourages natural communication. So that could be what they're interested in, things that they would like to talk about. We'll get into turn taking. The therapy is structured around turn taking format, which both the clinician and the client will participate in conversational exchange. This mimics real life interactions and helps the client to practice their communicative skills in a supportive environment. Next, we have client initiation. The client is encouraged to initiate communication about the pictures and the objects presented. This step is crucial as it allows the client to express their thoughts, ideas, fostering a sense of agency in their conversation. Lastly, we have flexible responses. The clinician's response to the client's communication in a flexible manner, allowing various forms of expression. This includes verbal responses, gestures, nonverbal cues, which help validate the client's attempts of communication.
So yeah, even eye contact, that's a really big deal.
Yes, eye contact. So overall, we just really want to get the main objective of what the client's trying to say. What is the meaning of where they're trying to go? So any nonverbal cue, moving your body, eye contact, drawing, writing will be valid response of communication.
All right, we'll continue. Okay, so we have 3 more steps for this process. So the 5th step is encouragement of meaningful interaction. The clinician focuses on the content of the client's message rather than the accuracy of language use. This approach emphasizes the importance of conveying meaning, which is central to effective communication. As we said before, we're not trying to go against the client saying like, oh, you should have said it like this is how you say it correctly. No, it's more about what are they trying to tell us? Like, is it a want, a need, something that they're inspired by that they want to just tell us about? Is it just something in their day that they thought was interesting? Let them go ahead and say it to you, and you're here to listen for them. And then also take a turn and let them respond back to you. All right. We have feedback and support. While PACE therapy does not emphasize corrective feedback, the clinician provides supportive feedback that encourages the client to continue engaging in the conversation. This may involve acknowledging the client's efforts and expanding on their contributions. So, as I said before, we're not just going through a list saying, like, how was your day? I was fine, and a conversation. No. Like, whatever they say, we're trying to build upon that so we can keep the conversation going. If they can only say 1 or 2 things, like either yes or no, let's keep on going with it. Like, what do you plan to do later on today? Let's see if we can expand on that speech. So that's a big part of it. And then we'll also go to number 7, generalization of skills. The ultimate goal of PACE therapy is to help clients generalize their communicative skills to real life situations. Clinicians may incorporate role playing or situational practice to facilitate this transfer of skills beyond the therapy setting. So, as we said before, this is not just to do it between the client and clinician. Of course, we're here to help them practice, but we want them to take these skills outside of the clinical setting and use it in everyday life. So, yeah, we'll continue. All right, and here's a demonstration of us doing this therapy treatment.
All right. So today for our therapy session, we are talking about promoting aphasic communication effectiveness, also known as PACE. So by doing this, we have a stack of pictures that will have face down. Me and my partner will be taking turns. So basically, I'll pick up one item and I will describe what it is, and my partner will identify it. And you can identify it by gestures, nonverbal gestures, writing, drawing, or verbally saying it. The real goal is really just trying to express yourself and say what it is, trying to identify the item. So first, I'll go first. So let me pick this up. Okay. So with this item, you're reading the item. It has pages. It has a front and back. You're trying to gain information. There's different types of topics you could read about in this item. You can open it, you can close it, things like that.
All right. You said information and you can open and close it. It has those things, those pages.
And there's numbers at the end.
Mm-hmm.
You could do this for a hobby. You could do this in class. You go to church. Typically, you're reading some sort of item.
It starts with the what's it?
A B.
Yeah.
Okay, we're on the right path. Okay.
Uh, a book.
A book. That's perfect. All
Okay.
right.
Okay, this thing you hit on it.
You're hitting on it.
And it makes noise. It makes like you can use it for music, and it goes like bum 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 bum, like loud music, like for a band.
A band.
Mm-hmm.
A drum.
Yeah,
A drum. Okay, so thank you.
All right, we'll continue now. Okay.
All right, so our long-term and short-term goals. Our long-term goal is for the client to improve overall communicative effectiveness, demonstrating the ability to initiate and participate in meaningful interactions using various communication modes, verbal, nonverbal, gestures, with familiar and unfamiliar partners, and 80% of structured and unstructured conversation opportunities.
Mm-hmm. All right, and so for the short-term goals, we have for number 1, in 4 of the 5 trials, the client will initiate communication regarding the displayed objects or images with minimal clinician prompting, indicating a greater degree of self-assurance in the expression and initiation of ideas. So basically with this, what we want to do is we want them to be a little more independent, like we're working on that to get to that long-term goal. So we're just going to be showing them pictures of the objects, like how we did with the example, like, oh, we didn't show each other yet, but if we needed to provide more cueing and prompting, then we would show the client that and say, oh, do you know what this is? Okay, let's describe it. If you don't know, like, what does this do? Does it make noise? Do you like play with it? Do you use it to do something else? Like maybe start a big car. Oh, is it keys? Okay, let's talk about that. Like, where do you put your keys in the morning? Things like that. We're just trying to get them to figure out, okay, how do I start this conversation? How do I figure out what I'm gonna say? Like, let me be more confident in it.
Yeah.
For number 2, we also have the client will enhance the quality of the interaction by responding to conversational signals with relevant gestures, words, or phrases to convey meaningful information in 4 out of 5 exchanges, prioritizing content over language accuracy. So for this, we would say anything like, let's say, gestures like shaking your head up and down, like nodding, saying like, oh yes, I understand, or I'm following the conversation.
Eye contact.
Of course, eye contact. Words or phrases like yes, no, if they have short phrases, and we're still working on that to build up to longer words. That's totally great. But yeah, these are the short-term and long-term goals that we have, and we'll continue now. All right, so these are the apps to support treatment. So for the first one, we have Smalltalk. So Smalltalk is a free communication app designed for individuals with aphasia. This application provides users with a collection of pictures and common phrases such as greetings, requests, dates, and activities to select if they require assistance while participating in conversations. This app also has videos to help people with aphasia view how to articulate different words or phrases, and it also has oral motor exercises to help strengthen muscles for speech.
All right, so now we have Boom Cars. Boom Cars is an application designed for educators and students to develop lessons and engage in interactive games that monitors their progress. Boom Cars offers a diverse array of activities aimed at developing any particular skill. It could be identifying, articulation, just overall a great application to work on progressing your personal skills. In this situation, there's a activity called identifying common objects. The client will participate by recognizing the common object using the visual cue provided on the program. So kind of similar to what me and India were doing. Let's say this is what's going to be showed on the screen. The client will say, oh, it's colorful, just practicing describing the object. So when we come to therapy, they know what we're looking for. Your writing, you're just trying to find ways to describe the object. The client can engage in an interactive game with a family member. They could do it at home. They don't always have to be with the clinician. And they can offer feedback. They're bouncing off. They're practicing those pragmatic skills. And telling them, giving them feedback on the accuracy throughout the transitions, switching to the next common object, because it's not always going to be that. It could be drums. It could be a pencil. Those type of things. This is a very enjoyable interactive activity that the client can participate in many environments, anywhere, any place.
But yeah, these apps are just to show you that it's not just within the clinical setting where this is where you can practice or have therapy. You can take these apps with you wherever, on your phone, tablet, smart device, anything. And then you can also work with other individuals.
Yeah.
So then they can also be aware of, oh, this is what I can do to help the person, like maybe it's a family member, maybe it's a spouse, maybe it's a friend. These are ways that I can help them communicate or get better at effectively communicating.
Yeah.
So yeah.
Pushing that genuine communication.
We'll continue. Okay.
All right, so we have the parent, caregiver, education, and information. So spouses and family members of people with aphasia will need to have education and training so they know how to do things at home. So kind of like our apps we're talking about, how to modify their conversational roles and the strategies and the expressive communication from the client. This could be providing visuals or verbal prompts, providing that feedback. It needs to be explained to the family member with the person with aphasia that this communication strategy will take practice. It won't happen overnight. So this needs to be a consistent thing you do every day or every other day, not just in therapy. And it takes patience to generate these desired outcomes. You have to push reinforcement with the person with aphasia and also never give up on them. All right. The interaction at first may be frustrating and under rewarding, but taking the time to work together will show positive results.
Yeah, it's just keep going every day, even if they get annoyed of it. Maybe take a break first,
Take a break.
and then just keep going with it.
Find different things. It doesn't always have to be a visual cue. You guys could be out in the store and maybe you see their favorite food and like, what is that? What is that called again? What's your favorite food?
Or practice going to like a restaurant, or before you even go to the restaurant, look at a menu. Say like, okay, what do you want for your appetizer? What do you want for the side dish? What do you want for the main? Like, keep going with that conversation. All right, we'll continue. Okay, cultural considerations. So we have methods for supporting communication include writing, drawing, using gestures, speaking slowly, and breaking down messages into smaller pieces of information. So we can't assume that everyone is already going to have the same type of communication style as us, especially as clinicians. We're supposed to understand, like, oh, these are all the different types that we may interact with, such as writing, drawing, gestures, or saying it out loud verbally. But we just have to be aware of what the client is comfortable with, because not everyone's going to be comfortable with talking out loud. Maybe they just want to write instead, or maybe they speak slower or they speak softer. So you have to be ready for all those.
Or a sign language too.
That's true. We can't forget that. Then we also have communication norms. So as we already said before, you may have different nonverbal cues. You may have other gestures that people use, or the use of silence. Not everyone wants to be a chatterbox and speak for the whole duration. So you have to understand, like, it's okay to have moments of silence, maybe a minute, maybe even two. Maybe just enjoy the moment with the person. That's how they get the best engagement out of this conversation. So, yeah. Then we also have cultural norms. So gender roles regarding asking for help, initiating a conversation, and thinking about mental and emotional health. These are all very important things, especially for who your client is. If you're dealing with the older gentleman, maybe he believes like, oh, I should start the conversation as the man. That's my role. versus maybe a woman. She's like, oh, you can say whatever the conversation is, I want you to start it, or it can be about whatever you like. So you just have to be ready to interact with those types of people and see how you should tailor the therapy towards their needs. And lastly, you also have the cultural interview. So you should conduct a pre-interview with the client and the family to learn more information about their interests, hobbies, and daily routines not included on the case history. Of course, the case history is very important to look at, but it's not going to include their whole life story. So you have to actually speak to them or speak to their family members, caregivers, whoever it is, and just figure out, okay, what's something else I know or I don't know about you yet that you would like me to know, and something that I can include inside our therapy. Let's make it interesting and rewarding for you. Yeah, we'll continue on.
Okay, so the outcomes of the treatment. PACE therapy has been shown to enhance communicative effectiveness in individuals with aphasia. Studies indicate that patients often demonstrate progress in their ability to convey messages and engage in conversation during therapy sessions.
All right, we'll continue. So these are some of the limitations. So for the first one, the PACE treatment is not designed for every population with a disorder. The authors argued that PACE should not be used for severely impaired patients because a clinician is too often uncertain about the patient's comprehension of a clinician's sending behavior. So not everyone's gonna understand, like, oh, I'm sitting here waiting for you to respond to my question or my response, and we're just sitting here for a good 3 minutes, and it's like, oh, I didn't know you were waiting on me, like I didn't know the cue. All right. For number 2, we have, as stated by Davis, clinicians must ensure they do not resort to a pattern when using visual stimuli such as picture cards, because this may lead to the client and clinician remembering the images rather than generating natural conversations. So as we said already with our demonstration, we have to make sure that you're using not just the same 10 or 20 cards every single session, because who knows how many times a week you may have this session. It could be twice a week, maybe 3 times, maybe once. So it's always good to just have a large collection of cards, or maybe different types of prompts, or maybe different questions to ask them. Just switch it up so it's not like, okay, let's do this, now let's do this. It's a routine now. It's trying to be more naturalistic, because in the real world, you won't have the same questions every day, like, hey, how are you doing? No, it might be like, what are you up to? And it's like, how do I respond to that? So just try to switch it up. All right, for number 3, according to these wonderful authors, in the modified PACE approach, feedback is provided not only for incomprehensible messages as the traditional method, but also for specific classification errors. Okay, and we'll continue on with the limitations.
Okay, so Davis discusses that PACE presents a problem with the respect of measuring progress in treatment activity rather than using goal-based generalization probes. A clinician's turn as a receiver makes it difficult to score a client's sending behavior while then having to figure out the client's message. So getting into multitasking, especially being a beginner clinician, you're engaging in the activity, you also need to write down, so it can be overwhelming, and that can impact the accuracy of progress for the client. PACE is considered to be PACE is not considered to be an efficient use for a short duration. So PACE is something that happens over time, going back to the parents and stuff. You have to do this it might take 4 weeks, it might take 5 weeks, it might take 6 months. As long as you're consistent and you're keep on with the routines, you're not only practicing in speech, you're also in therapy, you're using the apps, you're also doing journalizing this in natural environments, going to the stores and restaurants, reading those menus. You could consist and make more progress with that effective communication. 6, this is a helpful therapy method to use for individuals with aphasia. However, there is limited research on this method. So doing research on this, there's not a lot of current research on this topic. There's a lot of back in the day to the 80s, 69, but this is what we have found so far.
Yeah. So this is all to say, like, as clinicians, just be aware of these limitations. Sometimes you may think, oh, getting into routine and pattern is better. No, it's good. Remember what the rationale is. Like, this is for naturalistic conversations. And you just have to be careful with your own perception of what the client is saying. Because maybe I hear one thing, but as a clinician, I want to understand, like, is this what you were trying to say? Let me ask you again. Let me not just say, oh, this is what I think he was trying to say and put it down in the documentation. Because that's a big no-no.
Yes.
Of course, you want to be there for the clinician and get their message, not what you think they said.
Yes. And just take your time and hear them out. Tell them to take their time and also realize with this method, it's not only verbal, there's nonverbal. You can write it down, you could draw it, there's gestural cues, and overall, you have to pay closely attention to those things.
Mm-hmm. All right, we'll continue on. And here's our references. Amazing.
Amazing.
But thank you so much for viewing this video and have a great day.
Have a great day.